Hello and welcome to another Sunday WOAY Community Forum, where we talk to community leaders and local success stories to discuss important information that affects all of us here in Southern West Virginia. I'm your host, Caleb Pearl, and today we're joined by our guest, Kelly Gano, who is with the Raleigh County Prevention Coalition. Thank you so much for joining us. Thank you for being here.
Thank you for having me.
You're very welcome. Glad to have you. So let's open it up here. Just start off. Can you start by telling people who may not know, what is the Raleigh County Prevention Coalition? What is it you guys do? What's your mission? And how did y'all come together?
The Raleigh County Prevention Coalition first came together in 2017. It was a group of community partners who decided they wanted to do something about youth engaging in substance use. It started out as a group of 5 or 6 and grew quickly to 20 to 30 people being involved. And of course, COVID had some involvement in their participation in the community. With the mission to curb youth substance use by engaging different community partners who have a stake in the community that they live in. So Raleigh County is our main focus. So we do that through community collaboration, and there are 12 sectors that are required to be considered an official coalition, but the main mission is to prevent youth from engaging in substance use. And so getting to the root of that, of why they're engaging in that, how they're getting access to different substance use, vaping is part of that, is really the main goal.
And you had said that you had brought in people relatively quickly once you got going. I have to imagine that's unfortunately due to the fact that substance abuse here in West Virginia is so prevalent, and so many people's lives are affected by that.
Absolutely. We did a youth survey in 2023 to prepare for our Drug-Free Communities program, and in that we interviewed and surveyed a little over 200 of the youth that live here in Raleigh County that go to our Raleigh County schools, and 42% of those youth admit to using alcohol in the previous 30 days, and 37% of those youth admit to using tobacco or vape products in the last 30 days. So there is definitely some issues that we need to address as a community.
And is that below 18? Because that's a pretty staggering statistic, 40%.
It is. So we interviewed and we did a focus group with youth, and then we did the youth survey. And so they're all youth under the age of 18 who go here in Raleigh County.
So Kelly, tell me, what drew you personally to this line of work and to getting involved in this? And is there any certain story or experience that prompted you to be passionate about this?
Sure. So I was raised by my grandmother, and my mother had some substance use issues, and so this has affected my entire life and the life of my siblings. And it wasn't until my adulthood that I found out that my grandmother was actually addicted to opioids. So I ended up in foster care as a teenager, and so when I graduated college, I went into foster care work and was like, I'm gonna help all the foster kids. And then I went to a training that talked about stop pulling people out of the river and asking them what happened, go up the river and figure out why they're falling in the river to begin with. So prevention work really makes a lot of sense. It's easier to prevent it than it is to fix it once it's already happened. So this has been a passion of mine that I didn't even realize from the beginning, of helping our kids have sustainable futures free of substance use.
Well, thank you for sharing that story. I know too personally that the claws of addiction can sink very deep into some people, so thank you for sharing that.
Sure.
Can you, West Virginia's faced tough challenges specifically with opioids over the course of the years. How would you describe the current situation in Raleigh County as a whole, not just as it relates to youth, but for substance use in general?
So substance use impacts every aspect of our community, and that's why to be considered an official coalition, the 12 sectors need to be engaged. And so it's like your law enforcement, your healthcare, your small businesses, your civic organizations, everybody needs to come together to have an input, because substance use impacts your workforce, it impacts your social services, impacts your families, your school system. So it's really a community effort to curb this issue in our community because it impacts everything. Employees drug test, substance use makes people unreliable, it leads to homelessness. There's all kinds of different issues that it impacts.
So fortunately you recently have received a grant, right? Is that correct? From the CDC?
Yes.
So you got to make a big difference here, and that seems like something that could help you do that. So can you explain what the Drug-Free Communities program is that you're starting or that you're doing with this CDC grant, and how it's going to help make a difference?
We are so excited because this is a huge deal for Raleigh County in West Virginia. So it's a 5-year grant with an opportunity to apply for it a second time to make it a 10-year grant. $125,000. It's 100% matching from the community. So for every dollar the CDC gives us, the community needs to give that back. So it's actually a $250,000 grant. And that match comes from volunteer hours. So everybody who engages in this in the community, there's a volunteer rate. So with this, the coalition did a whole bunch of work to get to this. We had to graduate from the National Coalition Academy, which is a very intense year of evaluating our community, of evaluating the sustainability, the capacity that we have, and our readiness to tackle this issue. There's a lot of factors that went into that, and so once we graduated National Coalition Academy, which is the graduation was actually in DC. The coalition members got to go last year, and it was a huge deal, and we're super excited. But this grant works with the 7 strategies of community level change. And so with those changes include policy work, direct work with the youth, deciding on what the health disparities are, where it's impacted in the county, and providing focus on that. So we have coalition members who are working on vaping ordinances. We have coalition members who are working on teaching life skills to our youth. We have coalition members who are working on evidence-based curricula in the schools, working with 5th graders on building social skills to be able to say, this isn't for me, and really working with the modeling of that. It's not just like, hey, say no. It's working through those social skills. So there's a lot to it. We're super fortunate that to receive this through the CDC. It's very challenging. It's not an easy grant to achieve. So for us to have gotten it and CDC to be working with us, this is a huge deal, and there's a lot of potential.
And you had mentioned that that grant can be matched with volunteer hours, and that's one way to match that. Is it also possible for the community to donate to help match that, or is it all done through volunteering?
So there's different ways. So grants that are not non-federal grants, volunteer hours, and of course, if the community wants to donate, we've had several community members who really believe in our youth and the sustainability of their community for their future, so they have donated. So there's absolutely room for that.
So can you talk a little bit about within this collaboration? So you had mentioned all this outreach you're doing, but do you have any key partners you want to mention? I mean, you said you're working obviously in the schools, but law enforcement, parents, businesses, is that all part of your community outreach, and how exactly are you working with those organizations? Yes,
so the coalition is required to have the 12 sectors, and so that is what the board of directors is made up of. It's the 12 sectors and a couple of stragglers who are really involved in this. So civic organizations, our civic person is our chair, Danielle Stewart, with the Beckley Women's Club. Our law enforcement representative is Adam Justice with Beckley Police Department. Our local business is Marie Bechtel with Bechtel Law Offices. And then we're required to have like a media representative and a parent and a youth, our healthcare representative, somebody from every aspect of the community, so that it's not we're not just being good idea fairies. This is a strategically placed intervention that affects all of us. There's a lot of community help, and outside of those board of directors is a ton of people who believe in this, who support us, people who come and volunteer at the youth center. They'll come and work, teach life skills, help with homework. We have a baby pantry, so they'll come operate the baby pantry, seek donations. There's all kinds of places for people outside of these 12 sectors or outside our immediate partners.
So you had mentioned, you had said that getting to youth before they begin using drugs or using substances is easier than trying to treat people who have already become addicted or already have a problem. It seems like to me, both have their challenges in either direction. So what makes it so critical to get them to get to the youth before getting to substances, and what's at stake for them in the community if we don't get it right?
So it wraps around the science of brain development, right? So youth, their brains, and boys and men, their brains are developing all the way up till age 25. And so it's keeping them delaying onset of using substances for their brain to be fully developed, for them to be able to make critical decisions about their life. So it's very difficult to explain to a fifth grader or a middle schooler or high schooler that this is good for their future. Kids and youth are inherently impulsive. So it's really appealing to them in the way, in their language. So community events, putting them in the position of leadership, coalitions, our coalition and the coalitions across the country really believe in nothing for them without them. So we have a SAD chapter, Students Against Destructive Decisions, led by our healthcare sector, Kelly Elkins. And they're involved in the community survey, making decisions, participating in the strategies, and leading their peers to not be involved in this, educating them on the information. So once they are engaged, the vaping problem, I hear people all the time say, it's such a problem, we don't know how we're going to stop it. Disciplining them, the schools having consequences for that, they don't work. And they're so overwhelmed with it now that it's almost, teachers would be just spending their whole day stopping vaping if they followed through with the consequences.
That's what I understand to be true.
So, so once they're engaged in it, it's hard for them to see immediate consequences to that other than what the school implements to their health. So with our youth survey, we try and ask questions of do you notice anything? Breathing, is it harder for you to exercise? To try and get them to understand their own bodies and how this affects them immediately, because a lot of the health risks that come with vaping and substance use are long-term. So it's a lot of educating and getting peer trust. These SAD students and other youth who are engaging, getting them to talk with their peers and educating them to, hey, this isn't a good idea, and using positive peer pressure versus, hey, once you hit this vape, or you can have this. And one of the things that we're finding is parents are providing it to these youth. They're not seeing the negative impacts or the implications. So it's educating parents as well as the kids.
So Kelly, for anyone who wants to get in contact, volunteer, help out, get more information, how can they contact you and the Raleigh County Prevention Coalition? So
they can email us, rcfsc@rcfsc.org, or they can give us a call. It's a call or text, 681-589-0370. We'll get you involved. There's a background check process that we cover, so anybody can get involved. There's plenty of opportunity for sure.
Okay, we'll pick right back up on that in just a moment, but for now we're going to take a quick break, so join us back here for Community Forum in just a bit. Welcome back, and thank you so much for coming back to us here on Community Forum. Today we're speaking with our guest, Kelly Gano, who is with the Raleigh County Prevention Coalition, and we've been speaking about ways to help prevent substance use, specifically in youth in Raleigh County. And we've been having a great discussion up until now, and one of the questions I wanted to ask you, Kelly, was what do you see as some of the biggest factors that you see actually driving substance use among youth? I mean, you think of the common ones: peer pressure, stress, and access is a big one. Mm-hmm. So, I mean, what is it y'all are seeing that, what are you fighting so hard against? What's the big one?
So there's a couple of things. We did a focus group in 2023 as part of our community assessment. And in that focus group, there was a lot of insightful youth who gave us really good information. And one of them is adults and how we are engaging in substance use, right? So we're our youth role models out in the community, not just at home, community events, when they see us at school, when we go to their school things, standing outside, because everybody has to walk in the front door, right? So youth, parents, so if everybody is outside vaping or smoking, or if they're at a community event where there's alcohol use, we're glorifying alcohol use as a social aspect. And so they're not understanding how we're saying no to them, but yes to us. So how the community engages in substance use, whether that's vaping, alcohol use, and it's not just those who are in active addiction to opioids or other hard drugs. It's our gateway drugs, marijuana, and then advertisement. So especially specifically in Raleigh County, when we wrote this grant in April of 2024, there have been 12 vape shops, specifically for vape shops, not other convenience stores, specific vape shops added to Raleigh County. So that's
they pop
a year.
Up everywhere.
Yes. So those marketing practices, there's a science behind the bright blinking lights. And so there's some policy changes that could be there. But the other part of that is the bigger piece is the mental health aspect. So everybody says there's nothing to do, which there is plenty to do, but it's why youth can't engage in that is what we need to be looking at. Is it transportation? Is it cost? Is it overstimulating? My kids love to go bowling. It hurts my entire body to go to the bowling alley. So really figuring out what it is that they can't engage in it. Because the Icelandic model, for those not familiar, Iceland had a huge substance use problem as a country, and they tracked all of the data for 10 years. And in a gist, you keep kids busy, and they don't have time to be bored to engage in substance use. So a lot of the feedback we also got was depression and anxiety in schools. We talk about bullying problem, teaching kids how to be friends with others and teaching kids how not to be friends. Everybody is not your friend, but we teach that in elementary school as a fundamental level of, you gotta be friends with little Johnny, but you don't have to be friends. But what does that look like? We, as a society nationwide, if they're not our friend, they're our enemy, and that's not necessarily the case. So teaching kids how to have social relationships that aren't for them, and kindness, I guess, is the overarching theme there, and providing resources in the community to help curb some of that mental health.
You were drawing some lines and parallels here to aspects of society that I would have never thought to necessarily connect to substance use. So, I mean, it just runs deeper than I would have imagined at the level you kind of attacked this thing from. So speaking of young people, so, you know, I have a 12-year-old stepdaughter.
Sure.
And, you know, as you had mentioned, you want to set a good example, right? Like, lead by example, do as I do, not as I say. So beyond that, you know, do you have any tips for parents in that you've learned through your programs and through your techniques that you could pass on to help them with their own children?
So a lot of the initial curiosity with substance use is the unknown, right? So if you take that off of the table, then it's not as appealing. So if we're saying, no, you can't do that, human beings don't like no. That's a human nature thing. And kids are learning, their brains are developing. So it's not no, it's, well, tell me more about your curiosity. And really we're walking through what that is. Vaping in general, even alcohol has an appeal of, like, alcohol tastes bad, but companies will flavor it to make it more appealing and more user-friendly. And vaping is becoming flavored and covering up the smokes and their designs. So it's appealing to them, and marketing practices are targeted to do that. So it's really walking through what's the curiosity. Do you understand? Do you understand the whole picture? And teaching. We work with law enforcement who does DARE in the schools, and it's different than all the 90s babies who did DARE. And I was a DARE kid, and it was helpful to me even in the 90s. But nowadays it focuses more on the practice of having those conversations peer to peer, and providing them with the information. You know, kids want to know why. They're nosy, so they want the information, and we should be giving it to them, and not just of the bad aspects of it, but letting them know, you'll like this. You know, college kids, they'll go out and get drunk because they like being drunk. And flavored alcohol, it tastes good. So it's all of these bad things, but letting them know that there are good aspects of this, but your long-term consequences and what is actually happening inside of your body and what it's doing for your own mental health is not, it doesn't fix those things. This is a short-term fix. Leading with total honesty. Yes. That's the way. Yep. So Kelly, how do you measure success with programs like this or a mission like yours? Do you have any specific goals, any percentages you aim for to curb reduction by, anything like that? Sure. So part of this grant was that we had to have an evaluation plan, so that we can't just be out here having good ideas, that we have to be working towards something. And so each year we have to be reporting on that evaluation. So we picked two substances that were major issues. Alcohol and vaping were the two substances we were focusing on for this first 5 years. And so our goal is to reduce youth past 30-day use of alcohol by 10%, and then 20% for vaping. Yeah, those are big goals, but doable, especially with the right outreach. I believe you can do it. Yeah, engaging our youth and having them part of that is a big. So, is there any particular story that, since you've been working in Raleigh County here, a success story or even a challenge, something memorable, a big moment that sticks out to you as to why what you're doing matters? I think that we're in, the community is ready. Our kids are, there are challenges. So we're in the very first year of this. So we're getting into those challenges. Not every kid in this county or nationwide, statewide is exactly open to hearing the information. So they want to do what they want to do, but it's engaging them and shifting our strategies to make sure that they are included. So just because they're not ready and they're saying not yet doesn't mean we keep doing what we're doing. We change to keep them involved, because those are the kids that we want to reach out to, is the challenging ones, right? And so our youth center in Beckley, it's a drop-in youth center, so we have kids come in, we'll do life skills, and it's a safe, substance-free place for these kids to just come in, have a place to hang out with their friends, there's supervision, and it's a place to have informal conversations then. So if you schedule hey, we're going to teach youth about substance use, they're not coming. That room will be empty. But if you just have an informal place for them to come to, you can have those informal conversations. We have snacks and we feed them. So there's an incentive to come, but they stay for the connection. So it's a really unique place at our youth center of the kids that come in there. I love them all so much. We're going to give them the tools, and they're going to do great things with this community.
And Kelly, real quick before we wrap up, can you one more time tell us how to contact you, and if someone wants to work with you, how do they get in touch? How do they get involved?
Sure. So they can send us an email at rcfsc@rcfsc.org, or give us a call or text us at 681-539-0370.
And just real quick here, for anyone who might want to volunteer, there's all sorts of roles you have. Can you possibly give us a rundown of those real quick one more time?
Sure. So we have our baby pantry that's constantly staffed. We have our resource closets that need supplies, so you can do a supply drive. Our youth center is always looking for somebody to be there to teach life skills and just be present for our youth. We have community events that we're always looking for people to be at. So there's always room. We meet once a month. The first Tuesday of every month. So come on and join us and get involved in what we're doing, and there's a place for you for sure.
Kelly, it has been an absolute pleasure speaking with you today.
Yeah,
thank you so much for coming to join us on Community Forum, and we will look forward to seeing your mission continue, and we wish you all the success in the world.
Great, thank you so much.
Thank you so much for being here, and thank you for joining us for this week's Community Forum. We'll see you back here next week. Until then, take care.